Okay, good morning. My name is Jimena Chavez. My teacher is John Moscoso, and I'm going to talk about a phase 3 trial of Sebelipase Alfa in Lysosomal acid lipase deficiency. Okay, definition. Lysosomal acid lipase is an essential lipid metabolic enzyme that breaks down endocytosed lipid particles and regulates lipid metabolism. We conduct a phase 3 trial of enzyme replacement therapy in children and adults with lysosomal acid lipase deficiency and underappreciated cause of cirrhosis and severe dyslipidemia. That is one video.
My name is Mark Goldberg. I'm the Executive Vice President for Medical Regulatory Strategy at Synergy Biopharma. We're studying lysosomal acid lipase deficiency, which is an autosomal recessive disease due to mutations in both alleles of the gene that encodes lysosomal acid lipase. This enzyme is critical in cholesterol metabolism. When an LDL particle binds to the LDL receptor and gets taken up by the cell, the cholesterol esters and the triglycerides within the particle are hydrolyzed within the lysosome into free cholesterol and free fatty acids. And when this enzyme is deficient or absent, there's a dramatic increase in the amount of lipids that accumulate in the lysosomes of the cells throughout the body, but particularly in cells of monocyte macrophage lineage and hepatocytes. This leads to progressive accumulation of fat and steatosis in the liver, usually microvesicular steatosis, that progresses to fibrosis and cirrhosis, and leads often to liver failure, even in childhood. There's also a dyslipidemia marked by a high LDL and a low HDL and a variably elevated triglycerides that leads to accelerated atherosclerosis.
Okay. Let's
go. Extensive preclinical data in a very relevant animal model that showed by giving the recombinant human enzyme to replace the deficient lysosomal acid lipase, we could get the enzyme to bind to mannose and mannose 6-phosphate receptors on cells, get internalized, traffic to the lysosome, and replace the missing enzyme. We showed that we could reverse the fatty accumulations in the liver in this animal model. We could improve growth in the animals and improve survival. We've now moved into a phase 1-2 clinical trial that is described in this poster. In that study, we studied 8 adults over 90 weeks being treated with the enzyme, and we showed that with every other week treatment, we could see a dramatic decrease in the previously elevated transaminases. They started elevated, they came down into the normal range, and they remained in the normal range during this 90-week period. Similarly, with replacing the missing enzyme, we see a mobilization of the accumulated lipids. So once the triglycerides and the cholesterol esters are hydrolyzed, we initially see the mobilization as evidenced by a transient rise in cholesterol and triglycerides, but with continued treatment, these decrease to below baseline levels, and by 90 weeks, we see about a 50% reduction in LDL cholesterol compared to the original baseline, and a similar decrease in triglycerides, and a modest rise in HDL as well. The study is now ongoing, and we have a phase 3 trial in children and adults that's now fully enrolled and is maturing at this time. We hope to have data from that trial in the latter part of this year.
Okay, let's continue with the exposition. That is the same. So, application in nursing. In this multi-center randomized, double-blind, placebo-controlled study involving 66 patients, we evaluated the safety and effectiveness of enzyme represent. Therapy with Sebelipase, Alfa administered intravenously and dose of 1 mg per kilogram of body weight every other week.
We've got two presentations and a poster at the meeting. The first presentation is the results from a phase 3 study, which is a double-blind, placebo-controlled study in both children and adults with lysosomal acid lipase deficiency. The second presentation is a phase 2-3 study in infants with the most rapidly progressive form of the disease, which is typically lethal in the first 6 months of life. And then we have a poster which describes 2-year follow-up data on adults that were put into the first human study with Kanuma, and that's taken through to 2 years of treatment.
Okay, continue with the topic. We have ISO in Ecuador. The placebo-controlled phase of the study was 20 weeks long and was followed by open-label treatment for all patients. The primary endpoint was normalization of the alanine aminotransferase level. There is other video with the top.
Also, meine Damen und Herren, herzlich willkommen zum Clinical Journal für diese Woche. Und das Bild aus dem New England Journal diese Woche zeigt ein Torso von einem Mann, und das sind tatsächlich Telangiektasien. Und die Fragestellung ist nicht, was ist es, sondern was ist es nicht. Und 4 von diesen Krankheitsbildern haben Telangiektasien aufzuweisen, und darunter ist nicht Hämophilie A. Hämophilie A hat Faktor 8 Mangel, aber hat keine Telangiektasien als solches, aber die anderen 4 schon. Und wir gucken uns die mal ganz kurz mal an. Also das ist was es nicht ist. Dieses wird angewendet für Leute, die hämatologische maligne Erkrankungen haben, wie CLL oder auch ALL, wo die malignen Zellen CD19 exponieren. Und dann ist die Idee, diese T-Zellen jagen dann die Krebszellen und treiben die in die Apoptose und entfernen die. Und bei hämatologischen Erkrankungen, wo CD19 exponiert wird, ist die Gabe von CTLA-19-Zellen, so werden diese Zellen genannt, hat das zu erfolgreichen Ergebnissen geführt. Und hier wird diese Therapie angewendet bei Patienten mit multiplen Myelom. Und Sie werden sich daran erinnern, bei den multiplen Myelomen geht es um Plasmazellen. Und obwohl B-Zellen, die CD19 exponieren, viel mit Antikörperproduktion zu tun haben, differenzierte Plasmazellen exponieren kein CD19 und kein CD20, und darum ist Rituximab-Therapie nicht hilfreich bei einem multiplen Myelom. Aber was ich nicht wusste, ist, dass bei Patienten mit multiplen Myelomen haben die einen gewissen Anteil an malignen Plasmazellen, die CD19 exponieren. Das sind wenige, aber es sind manche. Und es stellt sich auch aus, dass mit der Chemotherapie, sei das mit Melphalan und Prednison hochdosiert oder die einfach Sauerstoff per Nasensonde gruppen 24-13% Behandlungsfall.
Okay, let's continue with the pros and cons. The pros. Secondary endpoints include additional disease-related efficacy, assessments, safety, and side effect profile. Cons. Substantial disease burden that does not include a very high level of low density lipopropane cholesterol in 38 of 66 patients and 58%, and cirrhosis in 10 of 32 patients, 31% who underwent biopsy. There is other video of the topic.
For those of us who see children, pediatric patients, lysosomal acid lipase deficiency is really very important. About 90% of all the cases that have been diagnosed to date occur in children. So this is primarily a pediatric disease. So the question is, if I'm a primary care doctor, if I'm a family practitioner, a general pediatrician, or maybe a pediatric cardiologist, what am I going to look for? How do I know what this is when I see it? I think it boils down to three very simple things. The key to me, and I'm a lipidologist here, but the key to me, first and foremost, is hypercholesterolemia. I want to look for high cholesterol. And in kids, of course, we want to do kind of the age-corrected thing, and for a young child, it doesn't have to be that high to be really, really high in terms of percentile. But if we have a significantly elevated total cholesterol or LDL cholesterol, then that's key number one. And we're focusing on this familial hypercholesterolemia thing. We're trying to screen the kids for that. We're trying to do cascade screening in the family, the whole thing. That's wonderful. But realize that whenever you see somebody with what looks like familial hypercholesterolemia off in a corner, we need to remember, could this be LDL deficiency masquerading as the typical case of FH? So the first piece, elevated LDL. Second piece, low HDL. Now HDL tends to be just a little bit suppressed in FH, but it tends to be even a little bit lower in the cases that truly have LDL deficiency. So high LDL, low HDL. The third element here is elevated transaminases. The liver is hit very hard by this, and you look primarily with elevated transaminases. Now, if you're good at a physical exam and the patient will relax for you and you can get a good liver exam, you can look for hepatomegaly. Virtually everybody with LLD has a big liver. And in some ways it's a little easier to pick up in kids than it is in adults. But I think the transaminases are actually even a little bit better than hepatomegaly, but look for both. Okay, so you got those three elements. If you see that, then you say to yourself, this might be that rare disorder, LLD. So then what do? You have your choice either to send out to your local lipidologist or a pediatric lipidologist. To me, the most important piece here, this is a rare disease which is rarely diagnosed, rarely appreciated. If we miss the diagnosis and it's picked up 10, 15, 20, 30 years later, then all that damage has occurred and the patient is way worse off than if we had thought about it when we had our children for lipids. Let's remember the high LDL, the low HDL, and then that transaminase piece that really doesn't belong with the other two if it's a standard FH case, or the hepatomegaly and or those two liver pieces don't belong with the other. That tells us refer for screening or screen and then refer if we make the diagnosis.
Okay, that it was a video of the topic. And then finally we have the conclusion. Sebelipase alpha therapy results in a reduction in a multiple disease-related hepatic and lipid abnormalities in children and adults with lysosomal acid lipase deficiency. Let's see the video.
Our bodies are composed primarily of water, and all the different metabolic pathways and chemical reactions that occur in the body must react with water. They must going to do. It's going to break down the triglyceride lipids into a form that makes it water soluble. Okay, we eat fats. We need fats in our diet. The thing is, most fats are like our oils, are oily, and they don't mix very well with water. So, and that's the only way we can absorb things is if they get into an aqueous or water solution. We're going to do a little kitchen experiment here. I've got a glass of water, just plain tap water, and some vegetable oil. Everyone who's done this knows what happens. The oil is going to float on top of the water. They do not mix. You have two distinct phases, water and oil. But if we add a detergent, we can get that to change. Now, this kitchen experiment involves the use of a detergent, and I want to make it clear that lipozyme is not a detergent, it's an enzyme protein. But since lipase activity is difficult to demonstrate in a way that would be visible to human eyes, we're going to use the detergent just to illustrate how a lipase enzyme is able to make fats be able to mix with water phases. Once the detergent goes into solution, it interacts with the oil and changes it to where it becomes water soluble. And so you have this milky emulsion. This is actually called an emulsion, but you don't have the oil and the water as two distinct phases. They are actually together. So if this was happening in our guts, anything that was in the oil phase is now available to be absorbed into the water and the cells of our body. The lipase enzymes we use in lipozyme have distinct advantages over the lipase enzymes found in the body. The primary advantage is that it is acid stable, and this means that lipozyme can start working within the confines of the stomach much sooner than what would normally occur. I have just given you some general guidelines on using enzyme products. You may have some questions, or you may have some...
Okay, it was the final video. Then, thank you.